Hello students, welcome to our channel once again, and I'm your mentor for pathology. Let's start our today's topic. We are going to talk about this atrophy, hypertrophy and hyperplasia today. Let's start atrophy. Atrophy. What is the definition of atrophy? It is the state where the cell size or cell number decreased. Means there will be a decrease in cell size and cell number. Okay? What can be the reason of atrophy? Number one, increase in protein degradations. Protein are degrading. Number two, decrease in protein synthesis. Means protein synthesis, this process has been stopped. Means somewhere the transcription is not going on. And what happened? The increase in protein degradations means loss of protein is happening. What is actually atrophy? Cell size or cell number decreasing. Why? Because the protein degradation or the decrease in protein synthesis. This is of definitely two types. All are two types: physiological, pathological. Let's come there one by one. Physiological atrophy. What is actually physiological atrophy? It is common in very early embryonic development. During the pregnancy, the early embryonic development, physiological atrophy happens a lot. Like decrease in size of uterus after parturition or aging. It's called involution. Okay, look at this. The size of uterus is decreasing. It can be of two reasons. Number one, definitely the protein machinery had stopped, means the protein is not synthesizing. And number two can be the degradation of protein is going on. So decrease in size of uterus after parturition or aging. There's a new term, involution, comes to you. Okay, what is involution? Let's see. This is the age at the 25. Okay, 25 years old woman is having this wide lumen and the size is a bit good. Now 55 years old, what happened? The size is decreasing, and when we go to the 75 years old, look at the size, it is really decreased, right? Okay, you have understood the involution of uterus. The term involution, what does it mean? The term involution means shrinking of organ in any special physiological conditions. Like after parturition, it is a special physiological condition, it is shrinking. During the parturition, the uterus must be enlarged. Why? Because to contain the baby, right? Now fact is, after the parturition, the baby is gone. The baby is no more there. So what is going on? This uterus will be decreased in size, and definitely during the aging after menopause the hormonal changes are going on. These two are the special conditions, special physiological conditions. So in these special physiological conditions, the shrinking of organs, suppose this uterus is decreasing, the shrinking is going on, so this is called involution. I think involution is clear to you. Okay, the next part, it comes decrease in size of thymus with aging. We all have learned about, we all have heard about this term, that the old person is having less immunity because of the less T cells. And you all know in the physiology, T cell come from the thymus. During aging, in thymus started to degrade, the decrease in size or the erosion going on. So decrease in size of thymus with aging is also can be the physiological atrophy. Next, the brain cell number decreased with the aging due to diminished blood supply, and this is known as senile atrophy. Now fact is, what you can memorize right now, the other elder persons like the age of 60 or maybe 70, they cannot remember like you. Why? Because the brain cell number are decreased due to aging and a diminished blood supply, and this is a part of physiological atrophy and known as special term senile atrophy. Let's see the diagram here. Look here, there's a healthy brain. Now come to the portion where the cerebral atrophy had gone. You don't need to know about these kind of terms, just look at this. This size had decreased, right? So this is all we have to understand. Okay, now the physiological atrophy. What actually happening in the physiological atrophy? Let's see. It can be nutritional, kwashiorkor and marasmus, and they are known as protein energy malnutrition, PEM. There are another thing is kwashiorkor. Like this pot-like belly is a characteristic feature of kwashiorkor. And next it can be as marasmus. Okay, this marasmus nutritional, in it coming in the category of the nutritional. Marasmus, this is the prominent rib cage in the marasmus. Okay, so what we learn about it is the pathological atrophy, nutritional can be the reason, kwashiorkor and marasmus. Okay, next it is the ischemic atrophy. What is ischemia? Ischemia is loss of blood supply, and what it can happen due to loss of blood supply? It can lead to hypoxia, means less oxygen. Okay, let's read this. Prolonged ischemia or loss of blood supply leads to progressive cell loss due to why? Due to hypoxia, less oxygen. Okay, prolonged ischemia or loss of blood supply leads to progressive cell loss, as in atherosclerosis cause less blood supply to the brain and leads to atrophy. Okay, atherosclerosis. What is atherosclerosis? You all know that during atherosclerosis some systemic artery or whatever will be blocked. As in that case, is the less blood supply is going to happen after the strokes, after the cerebral attack. We all have heard that some portion of the body or the part of an organ started to become paralyzed. Why? Because the brain cells stopped working there. It is a reason that it is happening because of what? Atrophy. Atherosclerosis causes less blood supply to brain and leads to atrophy. Okay, the next condition it is neurological, like paralysis had happened, poliomyelitis has happened. What is poliomyelitis? The muscles started to become rested. Okay, or the nerve damage can lead to atrophy. Let's look. This is a normal nerve, normal muscles. Okay, look how thick these muscle bands are, right? And suppose the atrophy going on, look how thin it had become. It is an example of muscular atrophy. Okay, next, disease atrophy, when you are not using any organ or any kind of part of your body properly. Okay, so atrophy due to disease of organ or muscle, like after fracture immobilized muscles go for atrophy. Okay, like this kind of thing. Look how thin the hand had become, it is due to atrophy. Okay, this is also another, this is the healthy leg, and there it comes the atrophic leg. Okay, you know the reasons. Pathological atrophy, let's come to the pathological atrophy. Loss of endocrine stimulation. Number one, diabetes. Number two, it is very important, shrinking of uterus due to loss of estrogen after menopause. After the menopause, the shrinking of uterus happens. You have seen it in the earlier slides that the uterus is shrinking after aging. It comes into also the pathological atrophy. Okay, pressure atrophy. What is pressure? Look, the tumor suppress the surrounding tissue leads to atrophy. The tumor can be of two types. It can be malignant or it can be the benign. Benign tumor, the growth is suppressing of blood vessels. So it can be when the blood vessel is being suppressed, ischemic condition will be there. Loss of blood supply will be there, means lots of oxygen supply, hypoxia condition. As that will be the hypoxia condition, atrophy will be there. Or suppose it is not the benign tumor, it is the malignant tumor. So what is going to happen during the malignant tumor? The malignant tumor invade inside the blood vessels. When it is invades inside the blood vessel, it is going to stop the pathway of the blood. That means just like kind of atherosclerosis, what was happening, the pathway of the blood was disturbing. So it ultimately leads to ischemia and then leads to hypoxia and then leads to tissue loss or atrophy. Okay, now come to this simple pathway, ubiquitin proteasome pathway. What is an ubiquitin proteasome pathway? You don't need to remember this. Just remember this term, ubiquitin proteasome pathway. What's its function? Its function is to damage protein removed and degradation by ubiquitin proteasome pathway. The degradation of the protein, we heard about this degradation of protein, right? This degradation and the damaged protein are removed by this pathway, ubiquitin proteasome pathway. I think this is all about your atrophy. And next one we come to hypertrophy. This term hypertrophy. Okay, hypertrophy means increase in cell size as it happen in the tissue that cannot divide. Suppose your nerve tissue, it cannot divide, but it has a huge workload. It needs to uh, do some more functions. Or your heart. Okay, the heart muscles, it cannot be what? It cannot divide the cells of the heart. but the fact is the heart need to pump more. So what will happen when the workload is increased, the cell size will increase in case where they cannot divide. Where they can divide, then they will increase their size, and that condition will known as hyperplasia, not hypertrophy. What it is in hypertrophy? Suppose the tissue that cannot divide, the cellular size will increase, and that condition is known as hypertrophy. Simple. Next, happens due to increase in workload. I think there is nothing to understand there. Next is increase in synthesis of structural protein. Whenever there will be increase in size, the structural protein will be increased, so synthesis of structural protein will be increased. Simple, nothing to understand, just remember this. It can be categorized into also physiological and pathological. Now come to the physiological hypertrophy. Athlete's bradycardia, it can be one. Next, gravicuterus enlarged due to the over secretion of estrogen. When the estrogen secretion enhanced or increased, the uterus size will be increased, and that is known as gravicuterus enlarged due to over secretion of estrogen. Next, lactating female's breast enlargement. You all have seen that when after the parturition, when the breastfeeding is going on, lactating woman is having large breast, and that can be because of the hypertrophy. Okay, next, pathological, it is the cardiac hypertension, and this cardiac hypertension, inside this pathological condition, we are going to learn about this cardiac hypertension into our next video in detail. Okay, just remember this for now. Next, we're coming to the hyperplasia. Very simple topic. Hyperplasia means increase in cell number as it happens to the tissue that can divide. Okay, the stimulations like growth factors are there, or the workload had this in that they cannot divide, they had increased in size, and that term as hypertrophy. But when they can divide, the cell number will be increased, and that is termed as hyperplasia. Okay, what can be the reason? It happens due to increase in workload again. Next, increase in cell division. Okay, the cell division will be increased because the number of cell are increasing, the cell numbers are increasing. For that reason, the increase in cell division will be happen. Okay, increase in cell division can happen in the two pathway. Number one, increase in mitosis. We all had learned about this. Mitosis increase the cell number. And number two, it can be increase in transcription, where there will be more and more proteins. You have heard about this transcription in your physiology and biochemistry. Okay, next, the condition physiological hyperplasia. Uterus and breast enlarge during pregnancy and puberty for hormonal changes. You all know this. Uterus and breast changes, size of uterus and the breast enlarged during the puberty and definitely during the pregnancy. Compensatory hyperplasia in the liver. Just remember these two. They are very important. Uterus and breast enlarged during pregnancy and puberty for hormonal changes. Compensatory hyperplasia in the liver. Next come to the pathological condition, endometrial hyperplasia due to the increase of in estrogen. Nothing to say here. Next is pathological hyperplasia can lead to the carcinoma. Now, what is carcinoma? Carcinoma is the cancerous growth. Okay, means when the cell numbers are increasing very much, there can be a reason. There can be one condition that the ceaseless growth or the ceaseless increase is happening, that is known as the pathological hyperplasia can lead to carcinoma, as it happened in the endometrial adenocarcinoma. Okay, so endometrial adenocarcinoma arises due to endometrial hyperplasia. Next, it comes, look at this slide. Okay, this is the normal endometrium, wide lumen. Look, wide lumen. Now, coming to the hyperplasia, look, the lumen had become very, very short and thin. Okay, the short lumen. Understood? I think this is clear. Next one. Pathological hyperplasia. It is also increase in androgen leads to benign prostate hyperplasia. You know what is a benign prostate hyperplasia? The size of prostate is going to be enlarged. Look here. There is a normal prostate size, there's an enlarged prostate size. This is an enlarged prostate size. When there is a normal prostate size, the urethra is okay, and the urine is coming from here and getting out. But when the prostate enlargement is going on, it is going to suppress from the both side the urethra. It has no place to go. So very less urine is going to come, and max of the urine is going to retain and gonna create some real trouble, and this is known as benign prostate hyperplasia, BPH, a serious medical condition. Okay, look, and overlook, this is normal cell, this is a normal cell. Let's count 1 2 3 4. Okay, now adaptation happen in case of hypertrophy. What is happening in the hypertrophy? The cell size is increasing. Look, the size at increase and the number is intact, 1 2 3 4. If it happens to the hyperplasia, the size can be same, can be decreased, that's not important, but the number will be increased. There were 4, and where it is 1 2 3 4 5 6, 6 are there, so number had increased. This is hypertrophy, this is hyperplasia.
सो दैट इज़ ऑल फॉर टुडे गाइस। अगर आपको हमारी वीडियो अच्छी लगी हो तो लाइक, कमेंट और शेयर कीजिए, और नए वीडियो पाने के लिए चैनल को सब्सक्राइब करना और बेल आइकन को दबाना ना भूलिए। थैंक यू।